Hello guys, I hope you're fine, and in this video we are going to discuss about the chapter number 2 of evidence-based practice. And why I'm making the chapter number 2 first, so basically as there was a high demand to make the video on this chapter first, so that is why I'm making the video on the chapter number 2 in this video, and then in the next video I'll talk with you or discuss with you about the chapter number 1. Now without any further delay, let's get into it. So the chapter number 2 is what do I need to know? So basically, what do I need to know? It means that what do I need to know when I'm formulating a question? So what are very important aspects which I should keep in mind when formulating a question? So this chapter is all about that. So in this chapter, we will look at that how to construct the questions and what are the categorization of the questions. So we have many different things in this chapter to discuss. So this is the content here that we will discuss about the overview of the relevant clinical questions, that what are they and why we need to structure them. And then we will discuss about the relevant clinical questions, in which we will also discuss about how to categorize those questions related to the effects of intervention, experience of the patient, prognosis, diagnosis, and then in the last we will discuss about the two different types of questions, and these are the background questions and the foreground questions. Now let's begin with the overview. So now the first point here is that the first step in the evidence-based practice is to ask the relevant clinical questions. So basically when you would ask relevant clinical questions, so this would help you to reach an accurate diagnosis, and later on you can treat the patient most effectively. And this all depends on how relevant your question is to the clinical condition of the patient. Then, by structuring the questions well, relevant evidence can be found more efficiently and easily. So again, if you would structure your question very well, so this would help you to find the evidence that is relevant to that question very easily and most efficiently. That is why structuring the questions well is very much important. Now let's talk about the relevant clinical question. So what is the relevant clinical question? It is definitely that question that is related to the clinical condition of the patient. And you can easily understand it by this well-known saying, that is, the beginning of all the wisdom lies not in the answer but in the questions. So this tells you that, for example, in a clinical setting, when you are actually doing your practice, so when dealing with the patient would tell you about anything that is related to his condition and what he feels very important to tell you about. So he would tell you about that, but maybe that information is not very much important to you. In your opinion, that information is not much relevant to that clinical condition which the person or the patient is suffering from. So your questions are in the end going to determine the clinical condition of the patient very well. So you should know how to ask the well structured questions from the patient, so that in the end you can reach an appropriate diagnosis, the accurate diagnosis, and in the end you can effectively treat the patient. So it means that your accuracy in diagnosis and in the treatment and many other things, they are going to be determined by how well structured questions you are going to ask the patient about. So here again you can see the first step in the evidence-based practice is to formulate the specific questions. The questions, for example, if you are searching for the intervention, the most appropriate intervention for his clinical condition, so you would ask the questions that are relevant to the interventions. You wouldn't ask the questions that are related to the experience of the patient or the prognosis, diagnosis. No, you would ask the specific question that you want the answer for. Now, questions should be formulated so it's possible to find the scientific answer to the questions. What does it mean? It means that the question you are going to formulate, it should be an answerable question. It should be a question that the research or the evidence could answer it, could provide the answer for. Now let's see the examples of answerable questions. So for example, what will be the effective intervention strategy for the poor balance in the old age population? Now here you are looking for an effective intervention strategy. So if you are going to formulate the question in this way, the research or the evidence which you are looking for, it can easily answer this question, because this is an answerable question. You are looking for an effective intervention for the balance training. So if the evidence is available for it, this can easily answer your question. Then the next question can be, could hip fracture be prevented with the balance training in the old population? So this question again is an answerable question. Now, how posing a specific question can help you in your evidence based practice? So, posing specific questions relevant to the patient's problem provides focus to thinking. So, if you have asked a specific question, so this can provide you the focus for thinking, you can easily think upon it and you can easily find an answer related to it. Then we have helps in the formulation of the search strategies, and it also helps in process of critical appraisal of evidence. It means that it would help us to understand that whether this evidence valid or it is applicable or not. So all these things are possible when you're going to pose a specific question that is relevant to the patient's problem. Now, how the patient's problem affects his or her day-to-day life, this is also very much important to concern when you are asking a question. Then, when informing any practice, so you would involve both of these things, the practice knowledge and the high quality clinical research. Why the practice knowledge? Because, for example, if you take a single disease, so that same disease can also vary in different patients. Every disease process, you can say it varies from person to person. So, you can't say that the evidence can best match each and every person for a single disease, for the same disease. If the person is suffering from, for example, the frozen shoulder, and there may be the evidence available to you, but that is more general, definitely, because the patient may be suffering from other type of conditions as well. For example, the person is suffering from the comorbidities, or maybe the patient may have developed the frozen shoulder because of the different reason as opposed to what is mentioned in the evidence. So you should also involve your practice knowledge in order to inform your practice. Now guys, let's discuss it with the help of a scenario. So a scenario is that Mr. Y is 43 years old. He presents with low back pain of relatively acute onset, about 2 weeks. So till here, it is telling us about the patient and the problem, that there is a Mr. Y. Definitely, he's a male patient and he is 43 years old and he is suffering from the acute low back pain. Then, with the pain radiating down his left leg. Alright, and the nature of the pain is that it is radiating pain. He has no apparent neurological deficit. Now they are telling you that the patient has no apparent neurological deficit, but we can guess that the patient has a radiating pain, so he may have the neurological deficit, and maybe this statement is a false diagnosis. So you should also keep this in mind, that this is unavoidable part of the practice. That is why you have to examine the patient very carefully, what you think that his symptoms are telling you about. Now let's see ahead. So the problem has arisen during a period of heavy lifting at work and has become progressively worse over subsequent days. Now they're telling you that his problem started when he lifted a heavy weight at his work, and since then it was progressively getting worse over the subsequent days. And Mr. Wise, general practitioner, prescribed the analgesics, anti-inflammatory drugs and the bed rest for the 5 days, and these were the interventions. They're telling you that these were the interventions that a general practitioner prescribed him. Then but this brought the little improvement. All right, but these interventions didn't improve his condition much. Then the Mr. Y was then referred to you for the treatment to relieve his pain and restore the physical activity. So they are now telling you that he is now referred to you and you have to relieve his pain and you have to restore his physical functioning. So this was the whole scenario, and now let us see that what kind of questions can be formulated from this scenario, and we will also categorize these questions according to, is it related to the experience or the prognosis, or what type of evidence it requires. All right, so on the basis of it, here you can see we can categorize it into the effects of intervention, the patient experience, prognosis, or the diagnosis. So these are all telling you that they require the evidence for the prognosis. The questions of the prognosis would require the evidence for the prognosis. Questions that are related to the diagnosis, they would need the evidence, they would require the evidence that is related to the diagnostic tests. Then the patient experience. So if the question is related to the patient experience, that would require the evidence that would tell you about the patient experience related to any intervention, or it can be related to any other aspect of his condition. The effects of intervention, so same with this case as well. And guys, this is a sequence of the questions you should ask when practicing. The questions that you would ask in the first place. So these would be the question related to the effects of intervention. Then you would ask about the questions related to the patient experience. And then in the last step, you would ask the questions about the prognosis and diagnosis. So first, the effects of intervention, then patient experience, then prognosis, and then diagnosis. And you can remember this by the IEPD. Okay, now let's discuss the questions. So first, I have categorized the 4 questions that can be asked from this scenario. So I have categorized it into this category, the effects of intervention. So here, the first question is, could this problem have been prevented? So here you are actually considering the intervention. Then in the second, if my aim is to improve his functional capacity, should I advise him to stay active or to rest in bed? So here again, you are basically comparing two types of interventions, that whether staying active is more better than staying in rest for this particular condition, for example, to improve the functional capacity. So this is also again related to the intervention. Then the third question is that can be asked from this scenario is, what can I do to relieve his pain during this period? So again, you are asking for the intervention. Then the fourth question can be, is there anything I can do to speed up his recovery? So you are again searching for a kind of intervention that could speed up his recovery. So these were the questions related to intervention. Now let's see the questions that are related to the experiences. Experiences of what? Of the patient or the physiotherapist? So the experiences are of the patient. So the patient is going to tell you that how he feels when he is given a particular intervention, or how he feels about his disease. Well, this thing is very much general, so the patient can have any experience related to anything during his whole disease course. So, what question we can ask related to the experience of the patient? The questions that would require the evidence of the experience. So the questions can be number 5. What does he feel about staying in bed or returning to patient? So here you can see we are actually concerning about the opinion of the patient, that how the patient feels when he would stay in the bed or return to the work. So this is related to the experience of the patient. Then the next question can be, what is his principal underlying concern about the condition? So here again we are asking about his principal concern about the condition. So it is also a patient experience. Let us discuss the questions that are related to the prognosis. As you know that what is the prognosis, first of all? It is how long a condition would require to get recovered, or it can be the chance of recovery. So guys, in this video I am only discussing about the questions that are related to these types, the intervention, experience, prognosis, diagnosis, but we will discuss each category in great detail in the next part of this video. So here just let's focus on questions that can be asked from each category. So we were on the prognosis, and here the question can be, what is the probability that the problem will resolve by itself within a month? So here you can see you are looking for a duration, and you are also looking for the probability of that condition that it will resolve by itself within a month. So duration is there, as well as the chance of the recovery. It means the probability is also there. So this is a question of the prognosis. Then we have the questions that is related to the diagnosis. To know that what is diagnosis, when you are trying to know what the condition patient is suffering from, so that is basically the diagnosis. And the questions that can be related to it can be, how can I decide whether he has a nerve root involvement? So here you have seen that the patient was having the radiating pain in the scenario which we have just discussed. So this is basically a question that is telling you how we are going to know that the patient has a nerve root involvement. Now the next question can be, which tests would be useful to rule out more serious conditions such as malignancy? It means that because definitely you know that the low back pain can be because of many reasons. It can be because of the disc herniation or the nerve impingement, or you can say it can be because of some tumor which can be compressing the nerve. So there can be various factors for the low back pain. That is why posing this type of question can also help you out in ruling out that whether it is a cause of some tumor. Now the questions related to harm or etiology, harm of the intervention. All right, and then the causes, or you can say the etiology. So what can be the questions related to it? For example, is heavy lifting the cause of his problem? As we have seen in the scenario that the patient has got the problem when he lifted his weight during the work. So this can be a relevant question regarding this clinical scenario. So now up till here we are done with all the types of questions we can ask the patient from according to different categories: intervention, experience, prognosis, diagnosis. Now let's see the importance of some questions. For example, the questions about the effects of intervention have the most important implications for the practice. So they are telling you that the questions that are related to the effects of intervention, so they are basically the most important questions in the practice. Why? Because most of the thinking and concepts in the evidence-based practice have been developed from research on the effects of intervention. Alright, so that is the reason why they are important. Then, a clinical question about whether or not to apply a particular intervention may require the information about effects of intervention, prognosis, and the patient experience. It means that if you are looking for whether you should apply a particular intervention or not, you would also require the information about the effects of intervention. So if you are looking for example, if you are willing to know the effects of short wave, for example, on the frozen shoulder, so you would first of all look for the effects of that short wave. And then the prognosis, it means that how long will it take for a patient who is treated with the short wave to get recovered from the frozen shoulder. And then the patient experience, for example, if the patient had been treated with the same intervention in the past, so he can tell you from his experience that whether it was bad for him or did it really relieved or alleviated his symptoms. So these types of information are also very much important for you when you are deciding for a particular intervention, that whether you should go for it or not. Now the questions related to etiology, that is cause or the risk factor. So the questions that are related to the cause or etiology, they are not immediately relevant to the practice. It means that they are not directly related to the clinical condition of the patient. And why is that so? For example, if the patient is overweight and you know that being overweight is a cause of osteoarthritis, so if you're going to give this cause a major importance, then you would promptly suggest him to lose his weight. But maybe if you would recommend him to lose his weight, maybe that is not much effective for him to alleviate the symptoms of the osteoarthritis, as opposed to if you might have gone for the other type of cause and have treated that. So as we know that there are many diseases which are multifactorial. It means that the one particular cause cannot be a major cause of it, and you might not be successful if you would choose a particular cause and you would treat that cause, but maybe the condition that the person have, maybe it has arisen from some different type of cause. So in this way, this type of question that was related to a cause, it is not directly related to a clinical condition of the patient, because it can help you suggest the intervention, but it does not confirm their effectiveness. As we have seen in the example of the weight gain and the osteoarthritis, that you have thought that the weight gain, maybe it is the most important cause of the osteoarthritis, and you have suggested the patient to lose the weight. So it might not be effective for him. Maybe some, if you would modify some other type of cause that has caused that illness to the patient or that condition to the patient, so that might be most effective for that patient. Hence, these questions, they are known as preclinical questions. In general, the studies of the etiology suggest the interventions but do not confirm their effectiveness, as I've given you the example in great detail. So I hope that you have understood. But it doesn't mean that all the questions that are related to the cause, they are all irrelevant, because there is one type of etiological research that is of the immediate clinical importance, and that is the research into unintended harmful effects of intervention. Now, how can you understand this statement? So, for example, if you have suggested a patient to undergo a specific intervention, and for example, if that intervention has caused the patient harm, so if the patient would tell you this, that the intervention has caused him harm, so this is also a cause of the condition, as that can be an important cause for the worsening of his condition. And if you would consider it, you can easily suggest him about the alternate intervention that could prevent him from the progression of the condition. So, the research into unintended harmful effects of intervention is very important. So, this is a type of question that can have the immediate clinical importance because unintended harmful effects of intervention means that these were the harmful effects that has resulted from the intervention that were unfocused. Physiotherapist might not know or he might not have noticed that this intervention would be harmful for this particular condition. So maybe this has resulted in the harm to the patient. So this type of research should be considered. And now the last point about it is that in general, evidence of the harmful effect of the intervention often comes from the etiological research. And yes, that information that this intervention can be harmful, it can have the harmful effects. So so the evidence that is related to this harmful effect of intervention often comes from the etiological research. So the etiological research would provide you the information related to the harmful effect of intervention. Alright, guys, that's all. I didn't want to make this video this long, but as I had to clear you concepts, that is why I had to describe you in great detail each and every point related to this topic. So, thanks for watching, and until next time.